We love complex cases here at LPID. I think it really comes back to what motivated me to be a dentist in the first place. Ironically, perhaps, I was here in the UK on holidays and I lost my front tooth. I was 9. I then suffered with a denture for a number of years and then got an implant when I was in my early 20s. And I had a pretty difficult experience through that period, both in the practice as well as it's not easy growing up without your front tooth. And it really inspired me to take on complex cases. My own experience was I lost gum and bone, and the final outcome was a challenge. And I was told at the time that you couldn't grow bone and you couldn't grow gum and you couldn't solve that problem. So I sort of had that in the back of my mind from when I was early on studying dentistry, that I wanted to learn how to grow bone, I wanted to learn how to grow gum, and I didn't want to believe them. I had that sort of know-it-all attitude, for better or worse. And it's really driven me through. So I and I think our team get a huge amount of satisfaction when we can give someone an exceptional smile, a great, healthy, long-lasting smile, an outcome where they've been told that they couldn't have that in the past. So we routinely have patients who come and they've been suffering with a denture because they were told they couldn't have an implant, or I had someone just recently who was going with a gap because they'd been told they couldn't have an implant, and it's very satisfying being able to solve those complex cases. Sometimes nowadays, actually, the complexity also comes from the systemic health of the patient, which can have a limitation on what we can do surgically. So we're very lucky to have Dr. Casanova, who has a PhD in medicine, who helps us sort of manage those cases, which has been really great. So I think, you've got to be careful what you wish for. We wanted to be able to manage complex cases, and now that really has become more common at LPID.